This is Today in Nursing Leadership, a podcast from the American Organization for Nursing Leadership. I'm Bill Klaproth, and with me is Adam Kless, Workforce Solutions Executive, Avant Healthcare Professionals, as we discuss why now is the pivotal moment to start building your global nurse pipeline. Adam, welcome.
Hey, Bill. Thanks for having me.
Yeah, it's great to see you. Thanks for stopping by our podcast booth.
Yeah, thanks.
Yeah, we appreciate it. So, Adam, long-term recruitment timelines create workforce stability. So how do long-term international recruitment timelines help stabilize workforce planning, especially as we approach 2028, 2030?
Yeah, right, yeah. So, we're able to forecast international arrivals and plan them out well into the future. We have such a deep and robust pipeline of nurses that we could plan out nurse arrivals years ahead of time.
Okay. So many health systems are bracing for retirements and rising patient acuity. How does building an international pipeline mitigate those upcoming pressures?
Yeah, well, rising patient acuity is going to alter the necessary staffing mix in the hospital. It's also going to require a different type of nursing skill mix as well. And the good thing about international is that you can actually go into our pipeline and select the specific skill level, the skill acuity, the specialty for the nurses to help really diversify out the hospital's workforce and meet those changing needs. In retirements, that's why I think, international is perfect on retirement, because you plan those out. And going back to our ability to schedule arrivals down in the future, you could plan a retirement for 2 years from now and queue up a nurse to drop right in.
Wow, that really makes sense. So are nurses in other countries, they're looking to come here to help with our staffing shortages? Is that right?
I mean, we are the most popular destination for international nurses, yeah.
Okay, so in your view, global recruitment really makes a lot of sense to help future-proof, right? It's kind of a future-proofing mechanism rather than a reactive short-term fix.
Right, yeah. So, when a healthcare organization partners with Avant, they benefit from our deep and robust pipeline of qualified professionals, which allows for a much more thoughtful, long-term solution to staffing.
Yeah, you can really plan ahead.
Yes.
And you can think about what your needs are going to be. So international recruitment expands access to highly qualified talent. How does expanding sourcing internationally then help leaders address those skill gaps that local markets currently can't fill?
Yeah, so expanding to international talent pipeline really allows leaders to hand select the very specific skills that might not be present in the local market, because not every hospital their market has the skill mix. Like maybe you don't have CVOR nurses, and we do. So, yeah.
All right. So thinking how other people might think, are there misconceptions about the qualifications or readiness of internationally educated nurses that you think might need correcting?
Yeah, I think, most commonly when people think international, they question their education. And the cool thing is about our nurses, their education has been certified to be the equivalent of a U.S. education. They have passed the NCLEX. But in addition to that, we at Avant have a very comprehensive clinical program that they all go through in our home office in Orlando. So extensive training and preparation.
What about language barrier? Is that an issue at all?
We typically recruit from countries where English is spoken within the country. However, we also have language support available. Okay. So we give that the entire time. And the vetting of their language skills is part of their skills training.
Okay, let me ask you this. How does international recruitment complement domestic strategies like residencies, float pools, and upskilling programs?
Yeah. So with residencies and upskilling programs, I think you don't always know if that nurse is going to stick around, and are they going to see the residency through? Are they going to get upskilled and jump ship and go somewhere else? But when you look at international recruitment, it really gives them the properly prepared professionals right when you need them. And the residencies take time, so you can plan it out, drop the nurse in, and they're ready to go.
So you've described global recruitment as kind of a one spoke in the wheel. What does an ideal multi-layered staffing model look like then in practice?
Yeah, hospitals really need to think about all of the approaches to staffing. So you're always going to need new grads. You're always going to need experienced nurses from your local market, but also adding international in really diversifies and gives you the experience level and the skill level you need right when you need it.
Well, Adam, I want to thank you so much for being here. One more question for you. What advice would you give CNOs who are struggling to blend short-term and long-term staffing strategies into one coherent workforce plan?
Well, you can start by visiting AvantHealthcareProfessionals.com, but I'd also advise examining your local turnover rate, days to fill your open jobs, your rate of non-productive time that you typically budget year to year for nursing. If you do this, it's going to give you a more comprehensive understanding of your long-term needs and position you for planning a consistent pipeline of nurses to meet patient care needs.
Absolutely. Adam, thank you so much. I really appreciate you being here.
Yeah, it was nice being here. Thank you.
Yeah. Once again, that is AvantHealthcareProfessionals.com. Adam, thank you so much. That is Adam Kless, and if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you at aonl.org/nursing-leadership-podcast. This is Today in Nursing Leadership. Thanks for listening.